Have you ever noticed something a little different about your body and wondered if it was important? Perhaps a change in your daily routine that made you pause and think, is this normal? One such common observation, and a frequent concern, involves changes in your bowel movements, specifically the shape of your stool. When it comes to pencil-thin stools, yes, they can sometimes be a sign of an underlying colon health issue. While occasional changes in stool shape are often harmless and related to diet or hydration, persistently narrow or ribbon-like stools could indicate something more significant that warrants medical attention. The why behind consistently narrow stools often relates to the physical pathway your stool takes as it moves through your intestines. Stool naturally conforms to the shape of the colon as it passes. If there is anything physically narrowing that pathway, the stool will emerge thinner. This narrowing could be due to something temporary and benign, like severe constipation, certain dietary factors, or even irritable bowel syndrome, which can alter bowel function. However, in some cases, it can be caused by polyps or growths, or even a tumor in the colon or rectum that is partially blocking the passage. It is important to remember that these more serious causes are less common but are why persistent changes need investigation. So what should you do if you notice your stools are consistently pencil-thin? The most important step is to schedule an appointment with your doctor. They will ask you about your symptoms, your medical history, and any other changes you have observed. Your doctor might suggest certain diagnostic tests, such as a physical examination, stool tests, or potentially a colonoscopy, to get a clear picture of what might be causing the change. The goal is to rule out any serious conditions and identify the root cause so appropriate steps can be taken. Medical professionals refer to consistently thin stools as a change in bowel caliber. This particular symptom gains more significance when it is accompanied by other signs, such as blood in the stool, unexplained weight loss, abdominal pain or cramping, or a persistent change in bowel habits like new-onset constipation or diarrhea. These additional symptoms can heighten the concern for a potential obstruction, which is why your doctor will consider your overall health picture. Being proactive about these observations is key to early detection if an issue is present. Ultimately, paying attention to changes in your body, like the shape of your stool, empowers you to take charge of your health. While pencil-thin stools are often due to minor issues, being aware and discussing them with your healthcare provider ensures that any serious concerns are addressed promptly. Early conversations and investigations can lead to peace of mind or the earliest possible intervention, which is always the best path forward for your colon health and overall well-being.